Good day everyone. I thought I should share my experiences at Promed wherein I had brought in my father for a heart complication. In today's time it's extremely important, vital to kind of choose the right set of doctors and right set of people to be with to kind of save the life of your dear ones. And when it came to my father, he had a heart complication wherein there was a block in one of the stents and his right artery was in a very bad shape. And even though I knew about the hospital, I was not able to immediately move him in, so there was a time lag. With all that, with a confused state of mind, I came in here. When I kind of came in, the mindset with which I was in was very clear. I knew I'm bringing my father to the right set of people, starting from someone in the corridor who receives you, someone who kind of does the entry in the reception, to the insurance people, to the nurses, to the staffs, to the admin people, and above all, it was a scenario wherein I had to bring in my father, who was like half dead, if I can say, use that word, because his heart rate was very poor. There was fluid accumulation all over his body, and I wasn't so confident in terms of his health. But when he came in and the first 2 days passed, and the kind of volatility that he had in his body, I was not very sure how it's going to go about, but I had a very settled mind, if I can say that, because the clarity with which the explanation was given to us from day one was brilliant. And I'm not just saying this because it is a scenario wherein my father is completely all right and he's back home. No, he came in with a 99% block in right artery, block in the stent on the left, fluid accumulation in the intestine, in the legs, and from the day one in ICU and shifting him back to the ward to look at the stability, the time that they take, that's extremely important that we need to know, like the time that they take to kind of assess a patient. We need to be patient and we need to be confident enough to trust the system which is there in place in Promed. They take their time to evaluate the patient, understand the body, give the right set of medication, and if it kind of alters, they revisit it, and then they come back and do all the corrections and ensure they take one day at a time. That's the best part. And most importantly, someone at the top, they don't kind of normally interact with the patients at the floor level, but Dr. Arun was there in our room on every single day, not just with me, with every single patient. He makes it a point to kind of visit every single patient, say a hello, to inquire how it is, and then give a very open and clear picture about where they stand. And that was absolutely brilliant. Luckily, God willing, my father is back home and I'm done with my first review. He is improving, but as I said, he's not completely out of the woods, as Dr. Arun always says with a smile, and as Dr. Anand says, it's one day at a time. So when I record this testimonial, it is not as if I'm like jumping in terms of my father's health. He is out of the danger zone, a little bit on the comfort zone, but he is getting better. But the fact of the matter is, you have nurses. I've kind of arranged nursing at home from Promed itself, and the doctors kind of call them and check with them on alternate days on how the patient is. That's very, very vital. I mean, they keep revisiting the health aspect time and again, look into the parameters, do all the tests if need be, ask you to come over as and when required. So it's extremely important that we choose the right set of people to travel when it comes to your medical, and Promed is the place to be in. Good luck to your team.